Good afternoon. I'm Dr. Duke Majan at the Duke Spine Institute. It is 9/11/25. Our patient comes to us from Washington, and she is young, but she's suffering with back pain, and she is tired of suffering. She did a Zoom call with me through our free MRI review. Turned out she had a herniated disc at L5S1, but she also has a problem with her piriformis muscle. Very common in patients with chronic back pain, pinched nerves, is they have bad posture, bad bending, and they end up tearing the piriformis muscle in their buttock. So what is the piriformis muscle and how does it get torn? What do we do about it, Henry? Why don't we show our audience the piriformis video?
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Duke piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Duke piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
And there you have it, folks. 4mm skin incision. And that's how we fix a piriformis syndrome. In her case, left side, but it could be bilateral. In about half of our patients, it's on both sides. These staples will come out tomorrow. We just put them in overnight. We'll get them out in the morning, and we are done. Any questions?
At this moment, no current questions.
Enjoy the rest of your day. Thanks for joining us. You've just watched a piriformis release at Duke Spine, and this is our patented proprietary treatment, minimally invasive Duke piriformis release. And good morning, I'm Dr. Duke Majan. I'm here with a patient from Kentucky who came here for a couple of issues, but one of them was piriformis syndrome. She had a torn muscle in her buttock. It was balled up tight with scar tissue, spasming all the time, causing buttock pain and compressing her sciatic nerve. So she had sciatic pain down her leg, and you had the Duke piriformis release yesterday. How do you feel?
Today, I feel really good. I no longer have pain going down my leg into my foot and heel. I just have some muscle soreness now, and we're at the surgical site.
And how long have you had that piriformis syndrome?
At least 8 years is when I first noticed it.
Yeah, 8 years. So, and the muscle was very scarred, and when I had to release it, I could feel how thick it was and how tight it was. So it went very well for you. What kind of problems did the piriformis syndrome cause for you in your life?
It got to the point where I would not leave the house because I could only go to work and come back because it hurt so bad to work and to do anything after work. I've had 2 surgeries on my hip, and the second one was a total hip replacement, and the pain was still there.
So you had hip surgery that didn't even fix the problem, and then you came to Duke Spine, you woke up.
And It's much better. I can walk without pain in my foot and leg. Like I said, just muscle soreness at the surgical site now.
How did you hear about Duke Spine Institute?
Online, I was Googling my symptoms and your website kept coming up and I ignored it for a while because I really just wanted to stay in my area if I needed any surgery done. And I finally decided, well, there's no one in my area who can help me. And so I clicked on your name and I thought, wow. Started watching your videos and saw that you had a free MRI consult.
Mm-hmm.
So I did that. Now here I am getting it taken care of.
Well, you hit the nail on the head. There's no one in your area that could help you. And that's true for millions of people suffering with back pain. Their doctors cannot fix them. So that's why we are so active online, trying to make people aware that there is help for them. But they have to travel to Florida. Well, right?
Yeah.
Beaches.
It's an easy jump down here. So
yeah, and you could see in the surgery, we went in with a 4-millimeter incision. And this is a pioneering new technology where I went in and released the piriformis muscle with almost no bleeding, no hospitalization. It was outpatient. So you actually went to your hotel with your daughter right afterwards, and here you are today.
Here I am.
So how is life looking for you now without this piriformis problem?
So much better. I am looking forward to getting back to my normal level of activities. One of my goals is to get out and hike, again, 5 or 6 miles a day. And like I was doing, I'm looking forward to that.
Awesome.
Yep.
Anything else you want to say to your family and friends and fans out there?
I would say that, do your research, but you're going to end up back with Dr. Duke. There's no one like him that I found. I did a ton of research throughout the country at first, and then I focused on my regional area, and there was, you're going to come back to Dr. Duke without any hesitation.
And we welcome everybody because we want everyone out of pain. That's our goal.
Yep.
That's our mission at Duke Spine. Get rid of pain permanently so people can have a normal life and enjoy life.
Right.
Well, congratulations.
Thank you.
You took the leap of faith. You came here and got it done.
Yes, absolutely. Thank you so much.
You're welcome.